All right. Hey, everybody. It's Jason with Kentucky Sustainable Living. Today, we're going to try our first alive and see what happens with it. Today, I've got Chuck Peoples with Appalachian Medical Solutions. And Chuck, tell us, start off. I met you at Self Reliance Festival, this last one that they had. Tell everybody kind of your backstory, all the little, you get a ton of letters after your name, don't you?
I've I'm a critical care paramedic. I've also got training in austere environment, prolonged care. I've done a little bit of everything in EMS. I worked about 20 years in traditional municipal EMS for a county agency, and then about the last 8 years, I've worked some contract work, things like that, and not only in overseas work, but also domestic and stuff. Everything from some executive protection work to occupational health and industrial work. So I've got a little bit of a varied experience in EMS. Try to get some experience in a little bit of everything.
Oh yeah. Well, you took good care of me when my blood pressure went up at SRF, and I was like, man, Chuck knows what he's doing. So Chuck, you've got tell us about your business that you've got started and what all you offer with it.
Well, I've done training for other people working as an instructor. I've taught EMT class, paramedic class. I've even taught at medical school. And I've been a trainer for the last 20 years teaching traditional EMS classes, but I started looking, and more people are interested in receiving medical care, but there's really not classes out there. There's your CPR, first aid, now stop the bleed, those type of things, which are important. They are, but they don't, in my opinion, give you some of the training that you may need in today's world. And if things do get worse, a grid down scenario, or the evident end of the world, zombies attack, whatever your scenario is, medical is important. It's not going to be, you're more likely to somebody to die from malnutrition and an infection, things like that, than you are really from a gunshot wound or things like that. Is it important? If you're a concealed weapon carrier, do you need to have that training? Absolutely. But I think the general public now, people who are the prepared mindedness, want to be prepared, and medical's a big piece of it. I've said it, and John Willis says it a lot. If you ever watch his lives with special operations equipment, it's not going to be the zombies getting me. It's not going to be the gunshots. It's going to be when I've got the little cut, that I cut my hand on fixing baling wire or something, or something on the pig pen or chickens or something, that doesn't go properly treated, that'll kill me. And that's very true. That's more likely to happen. And those are things that I started this company to do. So I want to give people, now, can I certify people in it? No, but this is for demonstration purposes only. And what you do with on your own time is fine. Now, do you get a certification and stop the bleed and things like that in my classes? Absolutely. But the rest of it is for informational purposes. It's very hands-on. I train a little bit differently than probably what your traditional model is. I do stress-induced training, and I'm very heavy with the hands-on. A lot of the parts of my classes, we start off with, you're doing it. Okay, we're going to do it. Everybody grab this. We're going to do this, whether it's a training simulator or whatever, or a live tissue lab. You're going to get your hands dirty in my classes. You're going to do the stuff. It's not, I hate PowerPoint, and it is not death by PowerPoint.
Yeah, I did a stop the bleed class to get recertified as part of my continuing ed with a contractor's license, and I did it with Bulwarks there in Glasgow. And we did a bunch of PowerPoint, did some stuff, and then the last thing to get your certification on it was they took us. They were like, start doing push-ups and jumping jacks, and then you got a scenario in a half-lit room.
Yep.
So you got your heart rate up running, doing all this, and then they bring you in and they're like, you got to figure out what's going on. And you're already hyped up. There's like two people screaming in there. You run up, they're covered in some kind of goo, which is simulating blood. So you're slipping all around. You're like, what in the world's going on? And I'm like, this is crazy. But
I do a lot of that one in my extended, I call it it's a stop the bleed class and more. It's a day-long class. One of the scenarios is what I call the sensory deprivation scenario, where you go into a room, you have a patient, you have to assess and treat what the major and one other minor injury is. And when you're in there, the room is dark, there's a strobe light going, there's extremely obnoxiously loud music that you can't hear yourself think, there's fog machine going, and there's me and maybe 1-2 other instructors yelling, screaming at you while you're doing it to get it. And the reason I do it is, if I can overload your sensories and stress you in the training, when you go to do the real thing, that muscle memory kicks in, and you're not as stressed. You're not bitter. You can think a little bit more clear, and you can do the mechanics that is needed to perform the treatment much easier.
Yeah. Oh yeah. And I mean, I got a lot out of that class, even though it was just your basic stop the bleed. That one thing, and we had talked before, as far as the aftercare and stuff like that, everybody wants to do the cool ninja tactical stuff. Let's throw a tourniquet on. They know how to do a tourniquet. They know how to do a chest seal. They know how to do this. And it's like, yeah, that's great. But, like you said, 90% of the stuff that's going to take you out is that infection. A lot of people don't focus on the aftercare part of it.
The aftercare, what a lot of people don't focus on and stuff, and I've noticed in some stop the bleed classes, and I am not here, and I'm not one to knock any instructor or how they do things or anything like that, but they don't focus on the important thing is your patient's in shock. Treat them for it. You've got to treat them. And one of the big things, I don't care if it's 110 degrees outside, they can become hypothermic very quickly. So you've got to do something simple as keep them warm, treat them for shock, things like that. And that's immediate aftercare. But what if you don't have help coming? What if you're going to have this patient for an hour, 2 days? I've worked in environments where we've had somebody that we applied a tourniquet to. We had them for 37 hours before we could evacuate them. And we had to care for them. We had to treat them. So there's a lot more to it. And are you prepared to do it? A lot of people want to be prepared, and they get some medical training. They get but a lot of it's focused on trauma. Well, guess what? In a grid down scenario, one of the first things that's going to go is sanitation, food sanitation, stuff like that. And those are some of the things that I go over. It may not be cool guy ninja stuff, but let me tell you what, it's just as important as the cool guy ninja stuff.
Yeah, exactly. And that's the big thing that I've stressed with some of the people in our group is we can do the cool guy ninja stuff, but we also need to look at aftercare and stuff like that. And people don't realize some of the stuff, how many bandages and gauze you'll go through caring for somebody. Tell us if somebody's got a minor or a medium injury that you can treat at your house in a grid down situation. How much gauze and bandages would you go through?
Well, there's a lot of it. So if you have an open wound and that you're going to have to, let's say, clean and pack a medium laceration, say 2 to 3 inches long. If you don't close it and you've got to clean and pack that wound at least once a day, in other words, you're going to have packing that you're going to pull out, and then you're going to clean that wound, and you're going to need saline or at least clean water. And what a lot of people don't realize is, and one of the things that I talk about is, they think you have to have sterile saline and sterile water and all this. Well, there's studies out there right now that, you know what, actually works just as well, and there shows no growth of infection or anything.
What's that?
Treated tap water. So if you have, like, on a city water service, a municipal water service, you can use that to flush that wound, but you're going to have to flush it and then use gauze and stuff to clean it. You may have to do minor debridement, where if there's anything growing on the inside or something, that you have to scrape that back, any dead skin cells or anything, or any dead tissue that is acquired on the inside. And then you've got to pack it again with gauze. That gauze you're probably going to use, let's just say a standard roll of 2-inch gauze, you're probably going to use on something that's maybe an inch deep, a whole roll of that. Yeah. So you've got to look at that, and it may take 30 days for that to close to do that. Now, the depth of the wound will slowly reduce as it heals from the inside. But remember, you've also got to wrap that on the outside and keep that clean and dry. So you may have to even change that bandages, because you're going to have, the wound is going to weep. It's going to leak fluids and stuff. So you're going to have to change that 4x4 you've got over it. That gauze that is holding that 4x4 in place, probably at least do 2 bandage changes a day. Yeah. So you're looking at, 100 rolls of gauze for 30 days.
Yeah. So you're looking at buying stuff by the case, is really, if you're serious about it.
You don't have enough gauze. That's what I like to say. I don't have enough gauze, and I've got cases of it. And I pack it up, because one of the things I realize in any type of a grid down scenario, my skill that I'm going to be able to offer is medical care. Do I have some other skills? Yes, but my so-called expertise, and I won't proclaim I'm ever an expert, but I'm going to provide medical care, so I should probably have that equipment with it. That's what my investment. Do I stock the food and stack the food and the water and all that other stuff? Of course, but I've probably got a lot of medications. I'm not going to say, but there's a good chance I may have a lot of medication that most people don't.
Yeah.
And there's a lot of things that are going on in today that you can go, like Jace Medical, you can get antibiotics from them. You do a phone consultation. There's a couple other companies that have came out. I just can't recall their names right now, but Jace is the big one that kind of got it out, and they're from Canada, but they're doing stuff in the US, and they'll send you an antibiotics package. And I think their most expensive package is like $250, which is not bad. And the antibiotics that are in there cover a lot of stuff. It's good to have, but there's a lot of other stuff you have to have. A lot of equipment you have to have. I've invested, I don't know how much money I've invested in medical equipment. And, it's an expense. It's a big expense, as far as prepping goes, if you want to be serious about it.
Oh, yeah. And I've looked at Jace Medical and some of their things that they offer, and it's good. I've also I've gotten fish.
Yeah, so, you can.
So, yeah, and the fish get sick every now and then.
Yeah, the fish do get sick, and sometimes they require antibiotics and things like that. That's good. But, like I said, I always have some sort of random medical thing laying around. But like, here's a roll of 2-inch sterile gauze.
Yeah.
That laceration I was describing, you're probably going to need 90 to 100 of these.
Yeah.
Just for that. And yes, can you pack a wound with regular rolled gauze, sterile gauze? Absolutely. The only difference between this and actual wound packing gauze, in wound packing gauze, the weave within the gauze, the way it's made, the weave of the gauze is tighter. But this will do the job.
Oh, yeah. You just might need a little bit more of it, right?
Yeah. So, it's just little nuggets of knowledge that I try to bring to people who don't have traditional medical training, and try to train them up and give them those skills and make them comfortable to take care of things like wound closures and stuff, because all this equipment now, again, I'm doing it for demonstration purposes only. I can't certify you to close a wound where you go out and open up your own wound closure clinic or whatever and say I'm certified by Chuck Peoples. No. But I'm showing that, and what you do in your own home on your own free time is completely up to you, and it's none of my business or anybody else's. But this is all equipment that literally you can get on Amazon. Yeah. It's equipment. A lot of it can be easily obtained, and relatively, it's not that expensive. But you need a lot of it. Some of it very expensive. Some of the equipment.
I've gotten a bunch of gauze from Amazon. You can search bulk medical supplies, and it comes up in case-lot quantities. And I found one thing. I run through Band-Aids being in contract, and I'm always
Oh,
cutting my fingers. And I'm like, I ordered, I think, a case of 2,000 Band-Aids. And they came in. My wife was like, what's that? I was like, it's Band-Aids. And she goes, you bought 2,000 Band-Aids? And I was like,
you'd
yep.
be surprised how many Band-Aids. And that's the thing is, some of the sites and stuff that I've managed with previous jobs and stuff like that, and doing equipment, I would order Band-Aids, in lots of 1,000,
Yeah.
at a time, because that's one of the most used things. In every medical kit I have a boo-boo kit, and I have Band-Aids where they're easily accessible, because guess what? I'm going to use that quite often,
Oh, yeah.
not only for myself or my family, but people that I'm treating or medical events I'm covering, and stuff like that. I mean, even going to the gun range, I'm usually, if we go to the gun range and I'm practicing or somebody's teaching, I'm the designated medic, just because I'm there. So I always bring all my stuff. And every single time just going to the range, I'll give out at least one Band-Aid to somebody. They get pinched from a pistol or whatever it is, I always do. So, people they don't think about the little things like that. And part of my class is I give you lists, suggested lists of equipment. And you literally look at that, because using gauze alone to wrap this, there's a technique.
Yeah.
There's a true technique. And I know you think, well, it's just gauze and just wrap it around something. Well, sort of, but there is a true technique to do it. And those are things that I really try to stress and teach, to make people very comfortable and they feel competent enough to perform these skills.
Oh, yeah. And I use, speaking Band-Aids, I keep 2 boxes of them in the glove compartment. And it's at least once, if not twice a week, I'm in the Band-Aids going,
Sure.
crap, I cut myself on a piece of tile or something like that. I mean, that's stuff that I think people should stock by the truckload pretty much.
Yeah, there's a lot of stuff. I mean, you don't realize, just even a wound care kit, that you're going to be treating a wound for a couple of weeks. You need a couple of syringes. You're going to need sterile water or sterile saline and to flush that wound and stuff, and using that syringe and there's a technique on how to do that. Just simply flushing that wound out and stuff. So it's just little things that I do in these classes, and I've developed these classes to prepare somebody who does not have any formal medical training, where they can feel more comfortable demonstrating that I demonstrate to them what some advanced medical techniques are. And they get to play with it hands-on for demonstration purposes only, so they can feel comfortable doing that.
Oh, yeah. Chuck, can you go into a list of stuff that your average, a lot of our people in our group are homesteading and doing stuff like that. What's some good stuff that they should have on hand? I mean, other than a little boo-boo kit with some Neosporin and alcohol wipes.
Yeah, I mean, you need Bactrin and Neosporin and all those little things. And I would, for your family, I would buy it by the tube instead of the little single packets, which you can get. And that's what I carry in my bags, because I'm treating other people and it's easier to do. And it's a little bit more sterile to give that. But buy tubes of that stuff. Little things like cotton swabs to clean wounds. Saline or sterile water. Sterile water is a little cheaper to buy and easier to obtain than actual sterile saline in bottles. Have that. And then in my classes, I actually teach how to do sterile water and how to make sterile water and sterile saline and store it for medical purposes. You obviously need gauze, a lot of 2x2s, a lot of 4x4s to clean things up with and do things like that. But you also need your over-the-counter medications. You need the cold and flu stuff. You need the over-the-counter pain relievers. And not only are they pain relievers, but if you've got somebody who's sick with the flu or a virus, has a fever, that's going to be a fever-reducing agent also. I would look into, some things for anti-nausea and stuff. There's some over-the-counter stuff out like that, but more of the prescription-based stuff is better. The over-the-counter stuff I found doesn't work as great. But, just have a good supply of just the regular over-the-counter medications, because a lot of people will go, oh, I've got a cold, I need to run out and get some, Sudafed or, whatever, NyQuil or whatever your flavor is.
Yeah.
But I would also, look at, basic diagnostic things. Get a thermometer, a good thermometer.
Yeah.
Learn how to take a blood pressure. Learn how to take pulse and where the pulse points are, not just in your wrist, your radial, but your carotid, your femoral, your pedal pulses, things like that. And that's important in assessment. I would get some sort of, within your trauma supplies, I would look at least having a SAM splint. A couple SAM splints where you can splint an injury. You can never have too much ACE wrap, ACE bandages. I would also look at cravats, triangular bandages, cravats, whatever you want to call it. Have some of those because they make good sling and swaths. There's a lot of applications with that. Ice packs are big. If you don't buy the actual disposable ice packs, have a way to have ice packs, but also heat. If you don't have heat packs, at least get a heating pad. The nice thing about disposable heat packs are they don't require electricity. So if you don't have electricity and need it, your heating pad is not going to work.
Oh, yeah.
Unless you're going to hook it up to your generator or power bank or whatever.
That's bad to run a generator just for the heating pad.
Yeah.
On the thermometers, I've got the digital thermometers, but I thought about too, I'm like, what if you don't have any batteries left? So I've got the old school glass thermometers. I bought like half a dozen of those and stuck them in.
Yeah, the mercury filled thermometers you can. And you can also get those little oral, and they also are oral and or rectal thermometers, but I would personally keep one for rectal and one for oral. I don't care how you get it. It's just that thought. You know what I mean?
Yeah.
And I have that, and they're well designated. They're a different color, so I don't have the wrong one. So I would have those disposable ones that are a little battery powered one. Those batteries last several years,
Yeah.
And you can have those, and if you keep them in, you store them properly and everything, have that. But if you do have ones that take batteries that you can change out, they're not an internal battery, get extra batteries and take the battery out of it when you store it. If you're not going to use it on a regular basis, pop the battery in when you're going to use it, so that way you don't have to worry, unless it's if it's a regular NiCad battery or something like that, you don't want to worry about, something leaking in it or anything and destroying the piece of equipment. Get a pulse oximeter, one of the little fingertip pulse oximeters.
Yes.
They're $20 and they work fairly well. That not only is that going to help you can monitor somebody's pulse, you're going to see if they're getting the proper oxygen. And the reason they're real good for the fingertip is your fingertips and your toe tips are the farthest place away from your heart. And what that's doing is that's reading the amount of oxygen that's actually in your capillary beds, your blood. So the farthest place that your circulation goes to in your body is your fingertips and your toes. That's why you do that, because if you're oxygenating well all the way out there, your blood is well oxygenated on your fingertip, obviously in the rest of your body.
Everything else should be good then.
Right.
Hey, real quick, Shelly's got a question.
Sure.
How long past expiration dates will over-the-counter stuff actually last?
There's a lot of factors in that. How it's stored. If you store it in a cool, dry place. Now, the FDA puts stuff on there, but there's studies out there. I can't say, oh, definitely it's going to be this. If it's stored properly, cool, dry place, and there's studies out there. You can look it up and Google it or whatever search provider you want. There's YouTube videos. There's one study out there now that the military did where they had 3 different antibiotics they stored for 25 years. Then they tested them. They found the one that lost the most potency still had, I believe it was 83% of its actual potency of when it was the day it was manufactured. The other ones were in the 90s, still had 90-some% potency on it. Over-the-counter medications, if it's in a tablet form or a capsule form, I could tell you, for me, I would be comfortable taking them if I know they were stored properly in a cool, dry place. I'd take them up to a couple of years afterwards, and maybe even longer. I'm just being honest with you, but you know, you could tell by looking at medications. It's like anything else. Some will start to break down naturally inside, whether it's a bubble pack or if it's in a bottle or something like that. If you start seeing breakdown of the tablets where they haven't been bothered or the bottle shaken or anything, they're probably not safe to take.
I took, and I'll tell you from experience, I had a bottle of Advil that rode in the door of the truck, and it was 5 years past the expiration date. And when my back hurt, I would pop 2 of those, and in about 15 minutes, my back didn't hurt. So I was like, hey, the shit still works. So,
I've done it. I've done it as a medical provider. If I'm actually acting in a professional role, of course, I'm going to say, you know, what the FDA says. Me personally, I've taken shit that's been 5 years worth of expired. I mean, I'm just going to tell you flat out. I've given it when my son was younger, you know, and he was still a kid growing up. I gave my own child, you know, medications that were expired, and he's still alive. And now I've got 10 children. So, you know,
so it didn't hurt him a bit.
He's still kicking.
Hey, if anybody else has got any questions, put them in all caps if you would, and we'll try to answer them. If not, we'll give you a BS answer about it. So
I don't know it. I'll tell you who to go to or where to look for it. That'll get the right answer.
Well, Chuck, tell us a little bit more about the training. Can you, if Joe Blow called you and said, hey, I've got this and this, and this is kind of what I want to do, can you customize some of the stuff, or is it just
I mean, I've got a list of classes. I've got a 1 day, a 2 day, and a 4 day class. Obviously, the longer the days, the more training. But on all of them, I can customize. I can do this. And I'm getting ready to do some for a client now that I'm customizing the class for something very specific, a live tissue lab that we're going to practice doing on a farm animal that will be shortly thereafter the class. Yeah, I can customize anything. If you call me up and say, hey, you know, this is kind of what I want for my family or whatever, yeah, we'll do. Now I've got a minimum number and I charge a set price depending on the class for what is, but I can work with people, you know, and if it's part of what I call our network, the Self-Reliance Network, you know, they got people with special operations or your group or, you know, Billy Bond's group or, you know, whoever, Toolman Tim, stuff like that. That's what I call the big network. I'm going to work with you because really, you know, that's the audience, you know, that I want to give these classes to. I mean, do I teach classes to law enforcement and medical professionals and stuff? Yeah, I do. But I really want to focus my whole thing for this. And the whole reason for even starting this is for Joe Blow, who wants to be more prepared, because I'm in the preparedness mindset. You and I have had tons of, you know, conversations and stuff about things. And I go to Self-Reliance. Yeah, I go and teach a class, but I'm not there to teach a class. That's just, you know, that's an hour of the time there. I'm there to learn and interact with everybody. You know, I think all training's good. And if you want something very specific, yeah, well, we can sit down and come up with whatever you want.
All right. And that's one of the big things is customizing the stuff. I think people really like that, where it's just not a boilerplate. Hey, we're going to teach X, Y, and Z, and that's all we teach. And it's like, okay,
I don't like to do the traditional. As I said, my training is probably not your traditional classroom, what you think it's going to be. It's very informal. It's very interactive. And it's very much hands-on. Because I'll be honest with you, even teaching PowerPoint bores the hell out of me. I can imagine. I don't want somebody who's paying me to do a class. I want them to walk away and go, damn, I learned something. I feel better. I feel prepared. I feel, you know, I can go and do these things. And in class, they say, I just don't feel comfortable with that. Well, I'm going to stay there until you do.
Yeah.
And that's just the thing. I'm providing a service. I want to give you the service, and I want it to be the best it can be and the best experience for you.
Oh yeah, for sure. I mean, I sat in your hour class and I was like, hey, this has got some real good points to it. And I mean, I enjoyed it. It was probably one of my favorites out of everything that I listened to that weekend. So it's probably in the top, I would say it's in the top 5 things that I listen to, and it's probably one of the most important that I listen to. Everything else is good to think about, this and that, but yours is the one that's going to keep you alive, most likely.
Yeah,
So,
it is, because it's going to be the little things that get you that you don't think about and you're not prepared for. And in any type of a shit hit the fan scenario, whatever you want to call it, if you don't have conventional medical care, you're delayed getting to conventional medical care, you could die. If you have somebody, you could have somebody you care about, a loved one or somebody on your team or whatever, they could die. And I don't want to see that happen. And if you don't have, a so-called medic, nurse, doctor, whatever, there to do this stuff, you are, as they say, the first responder, and you should be prepared. And do I do the traditional trauma medicine, the cool guy ninja? Yeah, I emphasize it. You get a stop the bleed class for me. It's not a stop the bleed class. Do I cover what stop the bleed says to do? Yeah, I go well beyond that, because I don't think stop the bleed is in depth enough. And I'm saying it right now. Sorry, College of American Physicians. I'm sorry if you get mad at me, and American surgeons, but I don't believe it's in depth enough. So I give more, because you should be prepared. Like, I carry a tourniquet every day. I mean, I literally just took it out of my pocket with my wallet and stuff right before we started this. But I have a tourniquet on me every day. I don't leave the house. It literally sits next to where I set my wallet at night. That's my daily tourniquet. In my vehicle alone, besides on me, I probably have 6 tourniquets. I have a tourniquet in everything I carry. My EDC pack. I've got my vehicle med bag. I've got another med bag that I carry in the back of my vehicle and stuff. I mean, I have these things. I believe in carrying and having all that stuff and blowout kit, IFAC, stuff like that. But I also believe you need to have it more in depth. My vehicle med bag is probably not like anybody else's. Mine's a little bit more and a little bit more in depth. And that's the things I like to show you, just really to get you to think about things, other scenarios, other things that could happen, because a lot of people don't realize you may see a car wreck and you pull up the side of the road. The reason that person wrecked, because they were having an MI, myocardial infarction, a heart attack, or maybe they had a stroke. They may not have big injuries, but there may be something you can do to help treat it and do little things until more advanced help arrives, things like that. So I just get you to think like anything. Think outside the box and look and how to assess your patient. Because to me, the biggest skill I can teach you is patient assessment, because that's what you start everything with.
Oh, yeah. With the tourniquets, a lot of guys just think about it. Oh, I only need my tourniquet if I'm doing cool guy, green googly-eyed stuff. I mean, in instance with me, I didn't have to use it, but I had a tourniquet on me, and I was taking down plate glass mirrors at a job, big plate glass mirrors. And but I had on cut-resistant gloves, and I had on gaiters, because right there, there's a lot of blood pumping through your arms. So I had on cut-resistant gaiters and cut-resistant gloves, but I had a tourniquet just in case, because I've seen videos of guys plate glass stuff just cut a dude's arm plumb off.
I in a real true scenario, I responded to a guy. They were putting in plate glass windows, fell somehow, and he sliced his popliteal artery on his leg, and I applied a tourniquet. He was bleeding out when we got there. Took him to the trauma center. He was trauma alert, and they rushed him straight in with the tourniquet still in place. Straight to surgery. He went from ER straight into surgery. He wasn't in the ER probably 5 minutes. So you have it. And when I worked traditional EMS, I carried, we have the bags and all the little stuff. I carried a tourniquet in my pocket. Yeah. You need those things immediately. On the outside of my med bags, I have a compact tear-off from John, for special operations equipment, IFAC, that has, the quick clot, the trauma dressing, the chest seals, needle decompression, all those things that will kill you in 2 or 3 minutes. I don't want to take the time of opening a bag, digging in a pocket, doing all that. I need that stuff because this person's going to die in 2 to 3 minutes. if I do something and act. Same thing with the tourniquet. You could be dead in 2 minutes. You get a femoral artery bleed, you got to slap the tourniquet on. You shouldn't take the time digging through a backpack or a bag or run into your car to go get it. I pull it out of my pocket.
Oh yeah, and a lot of the stuff going back, like with that plate glass that I was talking about, that's everyday stuff. Everyday stuff is going to get you more than anything else. A car wreck. I mean,
I've applied in real scenarios, and I've worked around the world. I've worked with cool guys, so to speak. I've applied more tourniquets because of chainsaw injuries, industrial accidents, home repair accidents, things like that, than I've ever done for a gunshot wound or an IED blast or anything like that. Have I done them? Yeah. But honestly, I've probably just as much, probably more, for just the usual run-of-the-mill stuff day accidents. I've done a ton of chainsaws. Chainsaws. I even did one, a guy, still don't understand how he did it. He cut one of the arteries in his ankle. He was splitting wood. And he hit a piece with a knot, and somehow it bounced off. Of course, he was splitting wood in flip-flops. So, but, those are just things that happen. That's why I say carry it with you every day.
Yeah, exactly. Oh, yeah. And I keep a bag in the truck. I mean, and you never know. I've got quick clot, gauze, chest seals, tourniquets in there, and I keep it. But I use the stinking Band-Aids in it 99% of the time.
Guess what?
That are the tweezers to get splinters out.
Yeah, and that's what you're going to use. Yeah, I mean, but if that splinter doesn't get out, or you don't treat that little cut, and take care of it and do the right treatment and clean it properly and let it heal, that's what's going to kill you in a grid down. That's what's going to get infected. And I've seen people. I saw a guy, he got his finger amputated, had to have it cut off because of a splinter. He left it in too long, didn't fool with it. It was dirty, didn't clean it, didn't take care of it, and he got gangrene in his finger. They had to take his finger off.
I know one lady that happened. She got something stuck up underneath her fingernail, and kind of let it go, and it finally got infected and got a bone infection. And they had to do, I think it's a PICC line or something like that, and give intravenous antibiotics for it. And the doctor's kind of like, I talked to her, and they're like, yeah, they might have to cut the end of my finger off.
Yeah.
And I'm like, over a stinking little splinter that got underneath your fingernail.
And that's what I teach. One of the big things I stress is wound care, and really go all over all the different increment ways of wound care, how to clean, how to do things, supplies to have, and show how to do it. What needs to be done, and for different types of wounds. You've got puncture wounds, you've got laceration, you've got avulsions, you've got dog bites. Human bites are some of the nastiest wounds you can have as far as carrying bacteria. All things. It's different types of wounds and different type of care for all of that.
Well, what I was letting know. All right. What now? Your website? Can people order stuff from your website right now?
I've got the supply chain issues. I'm a little business that's just starting, so guess what? I'm not a priority for all these wholesalers to send me things. I've gotten some equipment in. I'm going to get more. I'm going to have some kits up. I'm going to have some individual pieces, but I'm also going to have a kit, and I've done this with John's permission. I'm actually putting a kit together that you can buy, that is basically, if you buy a compact tear-off from John, it'll fill that. If you buy one of the big IFACs, it'll do that. I'm also developing right now a vehicle med bag fill kit. So you buy a vehicle med bag from John, you buy the fill kit from me, and everything you need goes in there that covers all different types of scenarios, and probably some you didn't think of. And it's competitive pricing. And then I'm also going to have individual tourniquets for sale, some individual pieces of equipment. If you need something now, you're in dire need for like just one kit, you can call me. I can piece together with some stuff I have, but I just don't have the inventory yet to get everything together. And all my kits are going to be they're going to be shrink wrapped together. It'll be sterile. It's going to come in. You're going to have everything. You take it out and you're just ready to go, and you put it in the slots. And I'm even going to have pictures of suggested ways to set the kit up. You know, so you don't go, well, where does this shit go? And all this stuff. So I just give you a suggestion on where to put each piece of equipment.
All right. So really, if I called you and said, "Hey, Chuck, I want to set up. I've got 2 vehicles. I want one in each vehicle. We can get it even with the supply chain issues. And I understand the supply chain. I'm in contracting, and it's stupid on stuff.
Yeah, I can. And the problem with this time of year right now, as far as medical equipment, this is when the U.S. government orders all of their stock and stuff, their big orders for the year. So all of the guys who provide tourniquets and quick clot and all that stuff to the U.S. government, guess what? Part of that contract to supply is we get our shit first, is what the U.S. government says. That's just what it is. So they get that stuff there. I'm going to be one of the last people. Now, if you need something right now that I don't have, Refuge Medical Bear, order from him. He's got a lot of the stuff in stock. Rescue Essentials is a good place. North American Rescue, all those places. I can give you lists of certain equipment. They're all good places to order from. They usually have, but they also have their own supply chain issues too. There's some major pieces of equipment they can't, that they've been out of stock for some time. So we're kind of at the mercy of that right now, but I'll help you out as much as I can. And if I can't supply you with the equipment, I will send you to someone and give you a name of somebody at that, because all those companies I just named, I personally know people there. I'll give you a contact name and, do that. Sorry.
Yeah. All right. Well, that's cool. Yeah. I mean, I'm looking. I've gotten pretty heavy on the first aid and the medical and stuff like that, just because I've seen where it's, everybody's like, oh, I've got 15 ARs, but I've got 3 Band-Aids and probably a knockoff Chinese tourniquet that says soft T. Hey, tell us.
There's 2. And yes, there's some other tourniquets out there. These are the 2 tourniquets I've used on real life patients multiple times. I trust them, and I trust my life with them. A cat tourniquet and a soft T tourniquet. A cat Gen 7 and a soft T, and they don't say soft T wide anymore because they're all wide. It's just the soft T. Their newest generation. Those work. Those I know they work. I've used them on multiple patients. I've seen them work. They're proven thousands of times over the course of the wars in the Middle East. Are there some other tourniquets? Yes. You've got the RATS tourniquet. I've looked more into the RATS tourniquet. I've actually reached out to the developer, the person who invented the RATS tourniquet, Kirkham, and asked him, hey, I've emailed him a couple of times about some questions and stuff. I can see some applications. I think it would be good for a secondary tourniquet. If you had to apply a second tourniquet, it works. It works great on kids and even canines. But I prefer the soft T or the cat. Those are the 2 main ones. I would carry at least one of those. But I always, 1 is none and 2 is 1. So in every kit, I would have at least 2 tourniquets.
Now, I was looking at the tourniquets. I've got cats and soft T's both. The soft T will go down smaller than the cat, right? For
Correct.
Kids. So then I thought that was right. So if you've got younger kids that you think possibly, Lord help you, you'd never have to. But if you got that, the soft T might be the better one to go to, don't you think?
And soft T is actually came out with a canine tourniquet now.
Really?
Yeah, they've got a specific canine tourniquet that is small enough to work on canines and stuff. and they've actually got some actual true dedicated canine products and some kits and stuff put out there. I can put together a canine kit for you if it's something somebody's interested in or whatever. I've actually talked to Joe at Canine Fortress about some canine kits. I'm going to consult with him on doing some stuff, like that, so he could put some canine kit stuff together. And we actually spoke about that at Self-Reliance, the last one. And but yeah, they have some things that they already have. And if you have a dog and you value your dogs, that's another overlooked thing. There's certain things you need to have for canines that don't necessarily work on humans. You've got to have some dedicated equipment for that.
Oh yeah, no doubt. I mean,
since you brought up kids, also some specific equipment for kids, that's calibrated for them. Blood pressure cuffs, even stethoscopes for young children and stuff like that. So, that's another thing to consider that I do go over in classes and things like that.
Oh yeah, and that's one of the overlooked things is a lot of the tourniquets and stuff were developed for fighting age males kind of thing.
All of this stuff is developed from the military, and every single bit of it is developed for fighting age males, guys who are in shape, who are carrying kit and all the stuff and all that. That's what they don't realize. That's what all trauma medicine, modern trauma medicine, has always been developed first from the military on the battlefield.
Yeah.
Where our golden hour came from was from the Vietnam War. That's where it developed from. So those are all things that where it comes from, but you just have to keep in mind it's all developed on, like you said, fighting age males, females. So us old guys, when you get into my age, into the 50s, you're not quite considered that anymore.
Oh man, I've watched some of the shows like they did. I watched a documentary on the PJs. And I was talking to she's a nurse practitioner in our group, and I was talking to her, and I was trying to describe it. I was like, I saw him doing this blood transfusion where they drilled into his bone, and she rattled off whatever it was, and I was like, I had to stop it. I said I was cringing. I said I was curled up on the couch going, oh my God, I can't believe they did that.
Yeah, it's interosseous. It's a way for IV access. And it actually is, believe it or not, through the bone and stuff. It's more rapid, and it's a drill, and it has a big old honking needle on the end, and you literally drill the needle into specific spots. You're at a certain point on your humerus, or you can go down in the patella and things like that. I mean, I've done it. I've got one in my kit. It doesn't really hurt. I could do it to you right now, and you wouldn't really feel it. But when I started pushing fluids, you'd come up off that table swinging at me. That's really when you feel the pain.
I watched them do it. They were demonstrating it. It was a military video, and they were demonstrating it. And it was this young 20-year-old guy that he was just thought he was tough as nails. They stuck that thing in. He was like, well, this is not too bad. And then they're like, just wait till we pull it out.
Yep.
And they had like 5 guys holding the dude down. And I was like,
you literally... God. To get it out, you counterclockwise twist it and pull it. Yeah, there's no easy way to get it out. It hurts. But yeah, the PJs, and that's where all of your modern medicine does. I've done training with the PJs. I've taken classes taught by former PJs. Those guys are those in the 18 Delta medics, the Special Forces medics who go through the 18 Delta classification school. They're the guy. I mean, both of them. They're practically PAs. They're physician assistants basically when they get out of their schools, and they're very well versed and outstanding practitioners. I've learned a lot from them, and I've trained with them, and I've actually taught some. And I always laughed every time I had some in classes. I mean, they all told me, "Oh, I learned something from you." I was like, "Look, you don't need to start here or whatever." I'm sure none of this shit was, anything new to you all.
Yeah.
But, it's good guys, and that's another place you can learn, just watching shit like that. I mean, honestly.
Well, what I've seen some of the classes, and when I start delving into one aspect of self-reliance and stuff, I check out a bunch of different people and look at all this. So I've just been, over the years, I've combed through all kinds of stuff. they've got some of the classes are like responder 1, responder 2, responder 3. What that doesn't tell me anything.
So a lot of them are building on just trauma classes, like refuge training. Bears Group. They do 3 levels of classes. One's a simple stop the bleed class. One is more an advance of tactical trauma. They throw in a few more things, and then I believe their 2-day class, they put in some tactics of movement and stuff like that, care under fire and stuff like that. It's basically the tactical combat casualty care class is what they're teaching. Okay. Excellent class, excellent instructors. I would recommend it. I haven't had a chance to take it yet. I've talked to guys at Refuge. I've talked to Bob, who's their operations manager, Chris. Gosh, his last name just slipped my mind. He's their director of training and stuff, and good guys. I mean, they're good guys. And from what I understand, I believe they're doing a stop the bleed class at the next Self-Reliance. So I'm going to have to come up with something that's not non-trauma for my lecture, which I already know what I'm going to do, which is going to be a very interesting topic, kind of controversial as far as for medical practitioners. They won't like it, but I don't give a shit what they think. I think the common person should know it. This isn't rocket science. I say it in all my classes. Medical stuff is not fucking rocket science. This is pretty easy stuff. It's just knowledge, and it's learning to take that information from here and put it to here.
Yeah. Oh yeah. Well, I don't think we're going to get too many questions. I did this. I don't have 1,000 subscribers yet, so it's limited on the number of people that could see. So, but I mean, we're going to put it up on YouTube. It'll be there. If you've got any more questions, you can stick them in the comments, and hopefully Chuck and I can answer those.
Sure.
Chuck, is there anything? We've been going about 50 minutes. Is there anything else you want to put in?
No, I mean, if anybody has questions, you're in the, in this big community that we're at. I'm always, you want to talk, shoot me an email. I'll call you. If you want to have a phone conversation, I don't have a problem. You want training, call me. I'll give you all the information. We can work something out, try to work it out together. I've been contacted since Self-Reliance by several groups. Some people only have 3 or 4 people, and I usually like to have a minimum. I kind of charge a minimum of 6 people to come, but I can, we can make it work, maybe combine, get some different groups together if they want to do a class. Yeah. I'll come to you within reason. If you're on the other side of the country, yep, it's going to cost you more for travel. Sorry, but that's just the way the world is. I'm nice, but I'm not that nice.
And you're not super far from me. You're just across in West Virginia.
Few hours. I'm literally like, I think about, I can be to you in 2.5, 3 hours at the most, depending on traffic at Lexington, just to be honest, but yeah, you're not far at all.
Yeah. And that's the nice thing. I mean, I'm going to have you come down pretty soon for a weekend and hang out with us. So
yeah. And I want to. I mean, if you've got a class going on, let me know about it. Or you've got a, you're putting on some sort of a festival, on something like that. You need some medical, we can work something out. I can come down and speak at it if you want me to, or, I always like to learn new shit too. So
it's going to be pig killing time soon, but you're not going to be able to save these pigs.
Well, we can do a live tissue lab, yeah, we could kill them. It just may take them a little longer to die, and we can do some practice work on and stuff like that.
But yeah, it'll be pig killing time. I know Shelly, I think, is going to process some pigs next weekend. I think I'm going to run up to her place and help her out on doing some pigs. So
yeah, I think John Witherspoon just did some pigs just a few weeks ago. I know he processed some, and I think I may be going down with his group down there. He's close to John. To do that. And then I've got a couple other people I'm talking to right now. I've got some dates scheduled next month in January, tentatively, to do a class for a private group. So, but they're within the network. I don't want to out them, unless they want me to. So,
I understand that.
Yeah, I'm doing stuff, and I'm really trying to focus on the group, and hopefully Nicole and John want me to come back. As far as I know, they did. They said we'll see you next time doing something. So I'll probably talking and boring people at the next Self-Reliance festival. And if you need equipment and you need training, give me a shout.
Oh yeah, definitely, for sure. All right. Well, Chuck, I appreciate it a bunch, and we'll end the live stream. So, all right, everybody that watched and everything that commented, I appreciate it a bunch, and we will be back soon. Thank you.
Thanks.